Welcome to National Apprenticeship Week. My colleagues and I have put together a short presentation as part of LCHS Apprentice Centre. This presentation intends to offer you a flavour of the nursing apprenticeship pathways available to you. Once the PowerPoint presentation is finished, we will all be available to answer any of your questions.
Hello everyone, my name's Lynn Ottaviano and I'm one of the part-time clinical assessors with the Apprentice Centre. I will be assessing Care Certificate, Level 2 and Level 3 apprenticeships. I've spent over 20 years in healthcare, mostly in practice.
Hi, my name is Anne Owen and I work with the Apprentice Centre to support the recruitment process for higher apprenticeship programmes. In addition, I provide pastoral support alongside the university for those apprentices currently in training. Welcome to a brief introduction to apprenticeship education.
Hello everyone and thank you so much for joining us. My name's Katie and I'm the full-time clinical assessor and quality nominee for the Apprentice Centre here at LCHS. I support with the assessment of programmes from the Care Certificate all the way through to Level 3 qualifications. So as you can see on screen, just a brief agenda. These are the different areas that we are going to be talking through today. Just as a brief snapshot, and as Anne has said, we will pick up on any questions that you have once the recording has finished.
So this is a ladder showing one of the available vocational pathways. As you can see, there's several steps on the ladder. You can jump on and off this ladder depending on where you want to be in your career. Everything starts off with a Care Certificate Level 1, which I'll be talking about shortly. So the Level 1 Care Certificate. So the Care Certificate was introduced by the government. It's designed as an entry level to care, specifically for those that are new to care. As you can see, it consists of 15 standards. These include workbooks to demonstrate your knowledge, observation elements, and also reflection elements. You'll be supported through the Care Certificate by an assessor and also by your manager. This opens the doors to all other qualifications. It's at the bottom of the ladder, and so it opens the way up for all the other qualifications that you might want to join. It's a first level requirement, and we also provide workshops for you to attend to help you attain the workbooks that you need to complete.
So as you can see on screen, the next step up the ladder would be Level 2, either Healthcare Support Worker or Adult Care Worker Apprenticeship. These are 12 to 18 months, including the EPA. They are suitable for learners who are new to the environment and do not previously hold any qualifications in the health and care sector. They consist of a range of mandatory units and optional units that relate to the job area in question. This is also completed over a variety of different clinical locations. The requirements, I want to draw particular attention to the requirements. Although it does state on their functional skills and care certificate, it is not a barrier to starting this apprenticeship if you do not hold these. They will be completed alongside the apprenticeship to support you when you go towards your endpoint assessment. The requirements for the endpoint assessment are that you've completed your functional skills Level 2. And the endpoint assessment itself will include a situational judgment test, which is a multiple choice test, and a professional discussion with an endpoint assessment representative. So moving on, next step up the ladder would be your Level 3 Senior Healthcare Support Worker or Lead Adult Care Worker Apprenticeship. This is 12 to 18 months plus endpoint assessment, and again, it's based over a variety of different clinical locations. The requirements for this apprenticeship would be Functional Skills Level 2 and also your Care Certificate. It is a requirement for Gateway once you've completed the portfolio element of the apprenticeship and you're going forward to endpoint assessment. If you are completing the Senior Healthcare Support Worker Apprenticeship, you will follow an adult nursing support pathway if you're wanting to progress onto a higher qualification in nursing moving forwards.
So moving on, the Nurse Associate Apprenticeship Programme is a 24-month programme and it provides an NMC qualification upon completion. Pre-entry requirements include Functional Skills Level 2 in both your Maths and English, which is equivalent to either an O-level grade A to C or a CSE grade 1. An example of a Level 3 qualification would be the Senior Healthcare Support Worker with the nursing pathway as shown earlier. This programme is open to both internal and external candidates who are able to demonstrate those skills, values and behaviours that are required to fulfil the role of registered practitioner before being recommended to the university for interview. Please note that all internal candidates must have their line manager's approval before applying for any of the study pathways. The current endpoint assessment for this programme is completed by the university and no longer by the organisation. Then we move on to the TopUp Program, and as the TopUp Program suggests, for those nurse associates and assistant practitioners out there who wish to further their career and train to become a fully registered nurse. It is advisable, however, that those practitioners wishing to develop have had a period of consolidation in their current roles before resuming their studies on this pathway. As you can see, the programme is either 18 or 24 months respectively, with a final qualification of registered nurse upon completion. And as with the Nurse Associate Programme, a pre-screen discussion will be held with candidates by the organisation, ensuring skills, values and behaviours that are required to fulfil the role of registered nurse can be demonstrated before being recommended to the university for interview. There are pre-university interview workshops available through the Apprentice Centre, looking at the sort of questions the university may ask you and the answers they would expect to hear back from you. Please ensure that you again have full line management support before applying for this programme. And finally, the Registered Nurse Degree Apprenticeship. This is a great programme. So as with the Nurse Associate and the Top-Up Pathway, there is a pre-screen discussion with candidates identifying the right attitudes and behaviours required to be a registered professional, remembering that the right candidates would also be future ambassadors for their organisation. The programme runs for 3 years and it supports applications both internally and externally on the proviso that the right pre-entry requirements are met. All 3 higher education pathways offer an absolutely amazing opportunity for those candidates who are willing and wish to work hard to further their careers. The team within the Apprentice Centre have extensive knowledge of the skills and attributes required to be successful on these programmes, and they work closely and in collaboration with the universities to support you to succeed.
So as you can see from the slide, we have put together some top tips that we can suggest. These are all really important as you go through any of the qualifications that we've run through this morning. So the first top tip we would have for you is academic reading and journals. This is a requirement from level 3 upwards, although we do encourage you to start looking at these earlier in different programmes. And they're imperative if you're wanting to progress to higher education. You should be regularly keeping up to date with academic reading that's relevant to nursing, if that's the pathway you're wanting to follow, throughout your ongoing learning, and especially in preparation for your interviews. You might just be asked to demonstrate academic reading when you have an interview with your university. There are library services available that can be accessed, and my biggest suggestion for those is to contact your organisation directly and they can support you with how to apply for these.
Second on the list, we have manager. So that means really that you need to have your manager involved with you in any of these qualifications. Your manager is there to provide support throughout your qualification. They've obviously got lots of experience which you can draw on, and also to allocate you time, the necessary time that you need to complete your qualification. So it's important that you have regular contact with your manager when you're on any of these qualifications.
Next on the list is qualifications. So we would suggest knowing exactly what you hold at the moment, because that's going to be really, really helpful to support you with what you might need to achieve to work towards your career goal, if that's towards nursing. We are more than happy to support you if you have any any questions around the qualifications that you hold already and what we can be doing to support you forwards. My biggest suggestion with these and your qualifications, if you are applying for any of the apprenticeships, make sure you have the qualifications and your certificates ready to hand so it doesn't add to the stress as you go forward to interview.
Next on the list is interview techniques. So as it comes closer to the time when you need to be thinking about interviews, the Apprentice Centre will give you support on interview techniques. So this might be in the in the way of sessions or workshops where we can put on mock interviews and we can ask you questions, some of the sorts of questions that you might be asked at your formal interviews, just to get you ready for that time.
Although all of these programmes are extremely rewarding, please bear in mind that certain levels of resilience are required to allow you to complete these. It will be a roller coaster at times, but it's supporting you to continually work forwards towards that career aspiration of nursing. We're confident the right candidates will have the resilience needed if you're going for higher education. If working through the pathway, your assessors and managers will support you with the skills to continually increase this resilience as you go through each qualification. So there is plenty of support out there.
And lastly on the list, we've got recognised prior learning. So before you start any of these qualifications that are on the list, make sure that you find out what previous qualifications you've done, dig out any certificates you've got, because any qualifications that you might have done in the past may be able to be assessed against your new qualification. So it might mean that you have a shorter time period on your new qualification depending on what you've done in the past.